As the situation of malaria continues to worsen in the country, Maracha district in Western Nile region has launched its indoor residential spray under the theme Instituting Malaria Smart Home Strategy as a gateway for malaria eradication in curbing the situation. This happened on 7th of January 2025 at Ibura Primary School playground in Maracha district, attracting different stakeholders such as health officers, government officials, community members, among others. Daru Jessica, Assistant District Health Officer for Maracha District, says Maracha is one of the beneficiaries of the intervention because of the high cases of malaria in the district.
Maracha District Local Government is one of the districts that has benefited from indoor residual spraying. That is the IRS in short, and we've been using it in a way to reduce malaria in the district. This is the third time we have implemented this specific intervention. And why Maracha has been chosen among all other districts is because Maracha has a very high burden of malaria in the district. And since we started having this intervention of IRS, we have seen malaria reducing drastically actually.
Whereas Ale Madiki, Maracha District Secretary in charge of social services, laments by saying the IRS intervention has positively impacted in curbing the malaria situation in the district.
Initially, Maracha used to stand at 53% cases of sicknesses in facilities, health facilities. Those were reported to be malaria. But the first IRS, which was done in 2022, helped us, but people did not realize the impact so much. But now, when we reached last year, that is 2023, the chemical was changed. This time we now use acrylic, which has so much helped. And we still have issues, despite the intervention of the government through IRS. We still have issues in the community, the mindset of the people. There are still community members that believe through going for prayers, they can still treat malaria. There are people who still have believed that when they go to witch doctors, they can still get medication for malaria, which is a myth.
Meanwhile, Moreno Rodrigo, the coordinator Picot Maracha District, highlights the audience with the activities they perform, more so the procedures of performing their duties.
We are contributing to the national goal and therefore strengthening the health system in Maracha District local government. Our interventions are basically on malaria reduction, and our mode of intervention is on ICCM, that is Integrated Community Case Management. We work very closely with our VHTs. There are so many other activities that PICOT has always been supporting the district with, and I am obliged and very happy through the office of the cow that they gave us very conducive working environment to see that the different projects that are supported by TASO and then PMI are successfully implemented.
Dramani Collins, Assistant Resident District Commissioner Maracha District, thanked the various stakeholders for the brilliant initiative, more so highlights on the challenges they still continue to encounter in fighting the disease.
I first of all want to thank the President for having put so many initiatives to ensure that malaria is eliminated in this country. I also want to thank the Health Department of the district for always implementing the presidential directives to ensure that malaria is eliminated in this country perfectly. I also want to thank the communities for always supporting the government programs, especially the initiatives to ensure that malaria is eliminated at a certain period of time. That is to say, by 2030. Besides all those challenges, besides all those achievements that people are trying to put in place, there is still challenge of misconception of some local people in our place. One, the issue of witch doctors. The issue of people believing that there's no malaria, which has been propelled by some people who don't believe that malaria is in existence. Secondly, there are those who believe that they can only be treated by witch doctors. This is something which is too big for us as leaders of this nation, as leaders of Maracha, as leaders of this country, that we all need to come on board to ensure that we sensitize our people against the issue of propelling misconception.
In the last quarter, Maracha district registered over 168,000 malaria cases compared to the previous quarters, in which the district registered over 500,000 malaria cases, indicating that IRS has drastically reduced the malaria cases in the district. Oraku Benson Pastore, West Nile Television Nilecast.